what data can we use to best take care of our patients? Because again, we're here to take care of patients every day.
I experienced the good, bad, and the ugly of healthcare. And I would say that the good was always with the providers, physicians, and the nursing staff that took care of me. The bad, to be honest, was the operational side, and just saw so many areas for improvement.
When it comes to cardiovascular care on the organizational level, MedAxiom understands the challenges your program is facing. Welcome to MedAxiom Heart Talk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom Heart Talk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom Heart Talk. I'm excited to introduce today's topic, driving the data revolution. Today's guests are Lori Walsh, joining us from Southeast Arkansas, and Karen Wilson from San Antonio, Texas. Both specialize in working with MedAxiom members. Lori is an executive vice president of membership and operations at MedAxiom. She leverages her 20 plus years of healthcare experience to help MedAxiom members build relationships within the industry and maximize MedAxiom's exclusive benefits to improve their programs. Before this role, Lori served as the Director of Operations for Heart Clinic Arkansas for 9 years. Karen is Director of Member Relations at MedAxiom and says she finds joy in combining her need to serve people with her unique love of numbers, data analytics, and the ability to provide order and understanding in a sometimes chaotic industry. She has also worked in healthcare for 2 decades and began her career in hospital administration. So welcome to the podcast, both Lori and Karen.
Thank you very much.
Thank you. So glad to be here.
All right, Lori, so I'm going to start my first question that I always ask Heart Talk guest. Why did you get into healthcare? Did you ever have that aha moment?
So great question. I have an undergraduate degree in zoology, and my plan was always to go to medical school. And I met my husband. He got into medical school, and I decided I would try healthcare administration. Had no idea, actually, there was a master's degree you could get in healthcare administration. And once I started, I thought, oh my gosh, where has this been my whole life? I love it. I love data. I love understanding a situation and solving problems. So once I started that program, and then obviously over the last 20 years, I have no regrets. Healthcare is hard. It's always changing. And so I love it. I love what we do every day here at MedAxiom.
Ugh, that makes me excited. You know, we all have our special gifts, right?
That's right. That's right.
So Karen, I'll ask you that same question.
Sure. I absolutely did have that moment where it became clear that healthcare was what I wanted to do. I had graduated from college. I was actually a business and an economics major. Started as a math major, have always loved data and numbers, but as the math got more theoretical, I was trying to figure out what I would do career-wise. So graduated with business and economics, was working on a management consulting type track in Washington, D.C. And I was diagnosed with a really rare form of cancer. And kind of threw me for a loop. I was 23 and was just starting to figure out what I was going to do as far as going to graduate school. Figured I'd get an MBA because that's what most people did with undergrad majors like I had. But all of that was kind of put on hold while I focused on myself and getting better. And really my first experience in the healthcare system, because I'd always been very healthy. And so I experienced the good, bad, and the ugly of healthcare. And I would say that the good was always with the providers and just the physicians and the nursing staff that took care of me through my treatment. The bad, to be honest, was the operational side, and just saw so many areas for improvement. And I thought, maybe this is what I'm supposed to do as far as taking my math brain and my business brain. And I was never really called to be a nurse or a doctor, but that was what I thought I could do and how I could possibly influence healthcare. So I switched gears. I got better. started researching where I could get a master's in health administration. That seemed like to make the most sense for me. So I did that, and I've been in healthcare ever since. Started out in the hospital side and then transitioned over to cardiology, and have been in cardiology for a long time now.
Wow, that's pretty amazing. And
Yeah.
I'll ask, how's health is good now? Everything's
Health is good now. Yes, thank you.
Wow, that's really good to hear. But that's certainly a way to make, your life experience translate into your life work.
Mm-hmm. Absolutely.
Well, as W. Edwards Deming says, without data, you are just another person with an opinion. We see a lot of that now. So, Lori, how might a physician leader leverage MedAxiom's cardiovascular provider compensation and production survey?
Sure. So first of all, we want to look at a situation and make a decision on data, not emotions. Oftentimes when we go into a program or we have a conversation with a program, whether it's a practice or a hospital service line, there's always emotions involved. There's people's opinions. One person's perspective can be very different from another's. So the data really leverages the conversation and neutralizes the emotions. So, if we say we need to hire a new physician, well, let's go back and look as why we think that. And let's look at averages. How many procedures are these physicians doing? How many patients are they seeing? So again, data helps us solve the problem, or at least point us in the direction to look for more information.
Yeah, I think there's an opportunity to have that emotional conversation, but then you should always shift it back to that data.
Sure, absolutely. Well, and also, again, a physician's perspective versus administrative perspective can be very different. Mm-hmm. And so how do we bring those two perspectives together with like data to say, okay, so maybe I need to adjust my thinking a little bit, or you need to adjust yours. So again, it's normalizing the conversation with data versus, sometimes you have people say, well, so I heard, or this happened. Well, one instance of something happened doesn't mean that we should make an entire change in how the organization operates. And so again, data collection and understanding how you benchmark your program against others across the country help us solve some of those problems.
Very empowering. Yeah,
very much.
So Karen, one benefit of MedAxiom membership is that they get a personalized performance review. So why is this type of performance review so essential, and what exactly does it entail?
So as part of MedAxiom membership benefits, all members have access to MedAccess, our benchmarking data. And whenever I'm working with members, especially new members or new people within an organization that might be new to MedAxiom, even though that group might have been members for a while, I always talk about the data. Just my own personal experience being with membership groups or groups that were members for several years. And because of my math brain, always kind of used the MedAccess data for years. And so personally, I have experienced that benefit and want to share that with members. So all members have access, but I tell everybody it becomes 100% more meaningful when you're looking at your own data within the system as opposed to just the benchmarks. What that personalized data assessment does is once a member has submitted data, we will follow up, we vet the data, we look at the data, we'll ask questions, we'll send an outlier report if there's some outliers we think need to be looked at. And then we send what we call a key indicator report. But it's a static report. It's on paper and you can see it. And I say paper, we used to hand them out in paper. Now we send them electronically. Right. But it's static. And so what I love to do and what we offer to all members is to go through the data with them live in the database, because there you see not only the benchmarks, but you see how you can use those benchmarks, look at different measures together, drill down into the data. And that's something you can't do when it's just on a piece of paper or on a static report. And so a lot of times what's really important with that is making sure the data is accurate, not only for the integrity of the database as a whole, but for that practice, wanting to make sure that data is accurate, and nobody will know that data better than that practice. And myself and Lori and others that have looked at lots of data for lots of members, it's amazing what you can tell about a practice when you're first looking at that data, but it's not our practice. And so I love to go through it with the member, ask questions, make sure it's right. There's a couple of key measures in there that we call denominators. So one would be physicians and APPs, making sure that the right numbers are in there, the right FTE amounts are in there, their specialties are correct, because you can drill down by specialty. So we want to make sure those are accurate. But then also patient panel. Patient panel is becoming more and more valuable as a tool when we look at the data, because in addition to be able to look at the data by physician FTE, so how many visits per physician or how many casts per physician, by using that patient panel, you can say, well, how many caths or echoes or whatever measure you want to say is being applied to the patient population as a whole, and how is that practice taking care of their patient population? So when I do a personalized assessment with a practice going through the data, I'm going to look at all those things with them and make sure that they're all accurate, and then show them how to use those different denominators when they're looking at different measures, because they're so meaningful. And sometimes they can tell the same story, sometimes they tell different stories, and we can just continue to drill down into the data, look at different measures that make sense to look at together. So it's really just a great opportunity to learn more about your data. And I think always a benefit to have somebody else looking at it with you too, who might have different questions or things that they want to ask.
Yeah, and interpreting it the same way.
Exactly, right.
Let's think through your experience working with members. Since you work directly with them, you have developed a relationship with them on their performance review. So can you share a specific example of really how this process has helped the overall team?
Sure. I recently one of our groups took me up on doing an assessment for them and reviewing the data, and that led to some other questions. They were specifically interested in knowing whether or not they could use the data to kind of put a case together for another physician, in this case, an electrophysiologist. And so they reached out and we were able to look at measures. We definitely used patient panels showing how many physicians they had caring for their entire patient population, applied some ratios for specialties. And it did look like their case, if you want to call it that, was justified for asking for another electrophysiologist. And so help them put that presentation together and give them the data that they needed to present that to leadership.
Yeah, there's such great value in that data and having someone to interpret it as well. So Lori, let's put on your operations cap. How might a program administrator use MedAccess data to identify maybe waste in the system, increase efficiency, or even improve patient access? And can you share a specific success story from one of your members?
Sure. So, patient access is probably one of the questions we get asked often. We can't get our patients in fast enough. We can't turn them over in the rooms quickly enough. And so the answer seems to always be, well, we need more nurses. We need more medical assistants. We need more physicians. We need more of something. In reality, sometimes it's just, we just need to work smarter, not harder. And I know that's a little bit of a cliche, but it's true. If you understand that X, you're trying to accomplish X, and the only way to understand that is to map that process and then look at data. So if a program said to me, we can't get our patients in fast enough, or the wait time is 6 weeks, or this physician can only see 10 patients a day, we would go back to the data and say, let's look and see what the average number of new patients per FTE physician is. So, on average, it may be 14 a day or 12 a day, or, whatever that number is. And we can compare that to that program's physicians or APPs or both and say, okay, so here's where you are, and here are our averages. And is there a delta there that we need to work on? And if we then said to them, you feel like your day is busy, but you're actually not seeing as many patients as others, the first response we usually get is, well, my patients are sicker. Well, everybody thinks their patients are sicker. So maybe it's that we are asking the physician to do work that other people in the organization could be doing for he or she. So how do I put you in provider mode versus just shuffling work, filling out paperwork, clicking in the computer? How can we put your expertise to work in a way that you can see more patients, because we're going to offload some of your work onto somebody else that can get that done for you and make you the most efficient that we can in the organization.
It's interesting, isn't it? It really allows everyone that you're working with to kind of operate in their genius, so that they're executing to the highest level as well.
That's right. That's right. And also that then brings them back to a satisfied person, right? Because everybody wants to be doing work that they find meaningful and doing the work that they were trained to do. So I need a physician in physician mode all the time, not filling out paperwork or not clicking the computer, doing things that somebody else can do for them.
All right. Well, that sounds like a perfect place to pause for a quick message for our Heart Talk listeners. Cardiovascular care transformation starts with data. To thrive in the new normal, cardiovascular programs need access to accurate and actionable data, analysis, and reports. MedAccess, the cardiovascular industry's leading proprietary database and business intelligence application, is driving CV care transformation. You can use MedAccess data to shape your program's financial and operational strategies. Explore multiple data points, drill down and compare by practice size, subspecialty, ownership type, and more. Get started at medaxiom.com/medaccess. Welcome back. We are talking with Lori Walsh and Karen Wilson about how MedAxiom members use data to improve their programs and drive care transformation. Let's drill down a little bit to the unprecedented moment that we find ourselves in right now that's continually changing and keeping us all on our toes. So Karen, the MedAccess website prompts members to understand, honestly, the true impact of the pandemic on your program, including the effects of the shutdown and your practice's comeback rate in multiple measures compared to the MedAxiom community. So why are these metrics essential for CV programs to understand right now?
So we all knew, we all deeply felt the effects of the pandemic, and we knew that it was going to affect volume. And we heard that loud and clear from our members. And so we thought, actually, during 2020, we reached out to members a couple of times and asked them to submit data with a monthly date of service. Historically, we've always collected analyzed data, but we knew it was going to be important to show a monthly impact from COVID and then that comeback. And so when we did the call for data for the 2020 data, we asked all members to submit that date of service so that we could then trend it monthly. And so now when you go into MedAccess, you have the option to look at the traditional annual data that we're used to looking at, but you can also opt to look at it monthly. And what that clearly shows is that trend and what that shutdown caused. But then now that we're continuing to track that monthly past the shutdown and hopefully into 2021 as well, it's showing that comeback. And so what you can see is very clearly that average or the median rate of comeback for all of our MedAxiom members that submitted data, and then show where your practice is comparing. So are you ahead? Are you behind? Are you at that volume that you were at pre-COVID? Are you not quite there yet? And so it's really going to give our members some answers to how not only the impact, which we all know was real, but how they're coming back from that. And we have that ability for any volume measure within MedAccess. So your visits, your caths, your other procedures, your testing, that monthly choice can be selected so that you can show how your comeback has compared to other practices.
That's good. It's a smart pivot, to get that real-time data quickly. So Lori, is data, the new norm? Because patients have more access to data than ever before, Apple Watches, wearable devices. Do you now expect providers to be on top of their game when it comes to this data?
So that's a really great question. There's two schools of thought here. Do we take all data into the program and then synthesize it and decide what's most important? Or do we only bring in the information that we currently know what to do with? And I think you're going to find different programs tell you different things. It's, as a patient, you have an Apple Watch now that can tell you a lot of things, but how accurate is that? Is it statistically significant data? How do you get it to your provider? So a lot of aspects of data that I think it's imperative that a program, if you agree with a patient to take in their external information, that you better act on it in some way. Because I think it's important that those patients know that that information is being looked at and is part of the overall decision-making process with their care. A lot of programs just say, nope, we're not taking it. We don't know how reliable it is. We weren't there to authenticate that the blood pressure was taken correctly, or that, your Apple Watch can now tell you if you're an AFib. Well, we have really great devices that can also tell you whether you're an AFib. So I think that the world is very data driven, but many programs are still hesitant to bring in the external data as part of the care transformation piece.
That's an interesting point, actually. As I'm listening, I'm like, wow. So Karen, what are some of the potential consequences of a program not understanding or leveraging its data?
I just think they're missing out. It's just such a huge resource. And it always makes me sad when we have members that aren't taking advantage of that. And so being able to make decisions supported by data is huge. And just having that as either confirmation of what you know in your head, or think you know in your head, or as an eye-opener that it might not be as you had thought, and you have that data to kind of show you that and other ways that you may need to look at other questions or consider other variables. I just think it's taking full advantage of this resource is huge for our members, and one of the greatest benefits of membership that we offer.
Mm-hmm. All right. To both of you, looking ahead to 10 years from now, when it comes to driving the data revolution for CV care, what changes do you foresee will have taken place? Lori?
Well, that's a great question again. So the problem that we currently have in healthcare is that we have so much data. It's hard to know where to look and what's the most important data for decision making for the program, the individual providers, as well as the patient. So, we need to think in the form of, what data can we use to best take care of our patients? Because again, we're here to take care of patients every day. So I think as the data continues to grow, we're going to find that programs are going to pick those top 5, 10, 15 metrics, and that's what they're going to focus on. And the rest of it is just background noise. So as a program, I think you have to understand what data you trust, the sources of where that data is coming from, and those become your day in and day out, weekly, monthly, yearly dashboards, those key operating data points that your program rely on. Now, that's a little bit in the weeds, and that's what MedAxiom likes to focus on, because we want to help programs solve their day-to-day problems. So MedAccess is great for that. But you have, in the world of data, you have surveillance data versus directional data. And MedAccess is directional data. So we're looking at the information and saying, okay, XYZ is going on from the year prior. So how do I take this data and make decisions for the future? Versus surveillance data is data we're collecting on a routine basis and making quick decisions. So I think there is a difference in what we look at from a surveillance standpoint. So that would be registry data that our programs are using, and they're making quick decisions sometimes off of that. Versus the MedAccess data is helping them see into the future. And as they build their strategic plan, they can use the MedAccess data from that perspective to help say, okay, if we need to gain market share, or we want to grow access, or we want to grow our physician bench, how can the MedAccess data help us solve those problems.
Mm. And Karen, same question for you.
Sure, Melanie. I think, the MedAccess data is pulled from an EMR. It's based on billing data, volume data, and data tied to the physician or the provider. But being able to tie that to quality data, and through our parent organization, the ACC, with their NCDR database, tying that together. So not only utilization and volume and how we're caring for our patient population, looking at panel or by physician, but then tying that to those quality metrics. I see a huge future for that. As well as artificial intelligence. That is not my area of expertise, but I think that is also going to be a huge potential impact on healthcare data moving forward.
Yeah, information and technology is changing so rapidly. It's wonderful to have both of you ladies on top of this. So Lori and Karen, thanks so much for sharing your time and your expertise today on MedAxiom Heart Talk. Thank you.
Thank you very much.
Thank you.
That's it for this episode. If you liked it, please tell your colleagues and let them know they can subscribe to MedAxiom Heart Talk on Apple, Google, or wherever they get their podcast. If you'd like to send us a note directly or suggest topics, email us at hearttalk@medaxiom.com.